Hey guys, Dr. Dex Alvarez here, and I wanted to answer a quick question that I had earlier today in the office, and it went really great with the patient, and they were able to understand this really well about a chiropractic adjustment and the ability to help out with sleep. We get it all the time nowadays with stress and devices and being on your phone. More and more people are having a hard time falling asleep and staying asleep at night. So I had the question today from a patient if there was anything that I could do to help to get them to sleep a little bit easier. So after we were talking about some different pattern changes by making sure you have a good sleep schedule, making sure you're not eating a few hours before you go to bed, and making sure that your devices are away and no light is in the room to disturb the sleep, we started talking about the patients having a hard time falling asleep and staying asleep. After we did a quick exam and took a look at an x-ray, we found out that this patient's first vertebrae was slightly shifted up and kind of tucking up underneath the base of the skull on the right. What that malposition of that first vertebrae can do is put an undue pressure on your brainstem, which would cause it to almost kink the hose and not secrete the neurotransmitter serotonin that tells your brain fall asleep and stay asleep. That's the hormone that tells your brain to shut off. So to be able to answer that question a little bit better, I was basically showing that x-ray and showing that if we get rid of that malposition and we get that first vertebrae back where it should be, which would allow that brainstem to secrete that neurotransmitter at the volume that it should, it's going to flood the brain and make sure that that patient was able to get a good night's sleep. So I can't wait to hear back on Wednesday to see how she's doing. But with patients in the past, we've had tremendous success with this. So if that's something that you're noticing where you're just having a really hard time at night turning your brain off, or you feel like your brain's going 100 miles an hour when you try to go to bed and you haven't had any success, might be a good idea to get in, have an exam done, have a particular set of x-rays done, and see if it's something that can be corrected with an adjustment. And then make sure that you maintain it so that you're able to have that good, restful sleep and you can wake up feeling rested and go about your day feeling great. So I hope this answers a couple of questions out there, and if there are any issues with that, feel free to reach out to the office and we'll make sure we get you scheduled to get looked at. Have a great rest of the day. Take care.